This is Christine Porter with the Times News. I'm here today talking with Dr. Ethan Payne, an ophthalmologist associated with Lehigh Valley Health Network. We're talking about cataracts and glaucoma and how they're treated.
It seems that cataracts are very common with people as they get older. Is that one of those inevitable things that seems to happen to senior citizens?
Yeah, to a large extent, it is inevitable. It's part of aging. Certain things can make them form faster, like we mentioned, but it really is just part of the aging process. And what happens is there's a lens inside the eye, a disc-shaped lens, and the way the lens cells replicate and the way that they change over time leads to a discoloration of the lens and eventually a clouding of the lens. And once you start to get those color changes and that, especially that opaqueness, the clouding of the lens, that's really what we call a cataract. And that's when light can no longer easily pass through the lens, and then a person becomes symptomatic and they feel like they're struggling, they can't see. So yes, it is inevitable if you live long enough.
And what's the corrective action for someone who has cataracts?
So cataracts has a very well-established and great treatment, which is cataract surgery. And so this is a procedure that's come a long way over the years. And what we do is we actually remove the natural clouded lens. We remove the cataract and replace it with an artificial lens that's clear. And it can really restore somebody's eyesight by doing basically a 15 or 20 minute procedure.
I guess you probably have to be awake for cataract surgery too, or?
Most people are, yeah. You don't have to be. Sometimes we do end up using general anesthesia where somebody is completely, unconscious with the ventilator, helping them breathe. But the risks with general anesthesia are greater. So we actually do prefer to do we call it, twilight anesthesia or monitored anesthesia, where if somebody they're a little sedated, they're, less anxious, a little sleepy. And then we use local anesthetic to numb the eye. So it's not a painful procedure. In fact, it's very unusual for somebody to have discomfort or pain. And 99% of the time that's fine. And even some of the most anxious patients, do just great with that.
So how is glaucoma treated?
Glaucoma is sort of an umbrella term for a group of conditions that cause a characteristic in the optic nerve. So would be a disorder of the optic nerve that looks a certain way and causes patterns of vision loss that are similar. And so you can have many different kinds of glaucoma. In general, the one factor, or the major factor that we as physicians can try to treat when it comes to glaucoma is eye pressure. The most common cause of glaucoma, the eye pressure is too high. It's above the normal range. And so we try to lower the eye pressure by using either medications that are usually given in drop form, so eye drops, or sometimes it requires certain procedures. And that might be a simple laser procedure that's done in the office, or in very severe cases, it might be a trip to the operating room.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.